Good evening, everyone, and welcome to Senator Johnny Isakson's live telephone town hall meeting. I'm Amanda Maddox with Senator Isakson's staff, and I'll be your moderator for tonight's call.
Well, Amanda, thank you very much. And to all of you on the phone, thank you very much for listening in. I always enjoy doing the telephone town hall meetings. It's the next best thing to being home, and I hope I can provide you with a lot of information that you want tonight. Hey, Dawn.
Hello, Senator. Hi, thank you for having this town hall and for answering our questions. I appreciate it a lot.
Sure.
I work in the field to support adults with developmental disabilities.
Yes, ma'am.
I've been in the field for 15 years. My mother and grandmother were. My grandmother worked with some of the first people to come out of institutions under Olmsted. And the proposed cuts in this bill now are the worst that I've ever seen in my time in the field. And my concern is, you know, I support people to get jobs and to be taxpayers that have disabilities, and our services make it possible for them to do that. They're optional under Medicaid waivers. So Georgia will be forced to cut these services because we don't have the funding for it. We're already 50th at what we spend per capita on people with Medicaid. And what I would like to know is one, as I've talked to a lot of legislators, they haven't been aware that Medicaid funds things like residential housing for people with disabilities. And they didn't realize that these services were not protected, that they will just disappear. It's not that they'll be cut back, they'll just be gone. And I wanted to know if, one, that's clearly understood, and two, is could we get a commitment that you would not support any bill that would do this much damage to the budget for Georgia? I think the last projection I saw was it would be a $4 billion shortfall over the term of the cut.
Well, I haven't seen that number, but I'm sure I don't question what you're saying is correct or not. But I know the bill that we're going to get tomorrow is not a bill that we've seen yet, so I'll reserve judgment on what the bill we get does. But let me tell you this unequivocally. I'm a big supporter of those that help people with developmental disabilities. I was on the Tom Novus board for years and supported the Bobby Dodge Center. In fact, I passed the first healthcare legislation in our state to allow employees in sheltered workshops to buy state health insurance because they couldn't buy it in the private sector because they had a disability, which many insurance companies wrote them off for being eligible when they shouldn't have been, because people with developmental disabilities in many areas are as healthy or healthier than anybody else may be around. So we've got to make sure that they don't get cut off or cut back. I'll wait and see, and I'll follow the bill closely, and I'll promise you I'll never knowingly vote to cut a developmental disability benefit, but I'll never knowingly expand that benefit without it first being thoroughly debated. That's one of the biggest differences in what a lot of people don't understand about what's going on up here. Is there are a lot of people trying to expand programs that are their program of interest by some amendment process for the future to raise benefit. We need to know, first of all, what we're doing today, develop a baseline, treat everybody alike, and then move forward in the future. And I intend to be a part of that, and I'll tend to work for people with developmental disabilities as long as I can.
Well, thank you very much. I appreciate that. I spoke to your regional director in Atlanta, and he was very nice, and we had a good conversation. So the advocacy group that I represent, which is people all across Georgia, we're more than willing to be a resource and to sit down with, your staffers or you and provide any insight information that we can that would help you make those decisions.
You keep in touch, and we'll talk as many times as you'd like to, okay?
All right. Thank you very much.
Thank you very much.